different languages.
Today, if you want to go to the next slide, just gonna do the little intro. Here's our cool pictures. So like Jeremy said, I'm Kim. I've been in the county for about 20 years doing parcels and other fun things. And I'll let everyone else kind of say what they want to say.
I'm Emily. I've been in the county for 8-10 years. Who knows anymore? Everything blends together. But I've had various roles with Racine County. I started out in engineering, went to public works, then zoning. Now I'm in real estate. So with lovely Kim.
Hi, everyone. I'm Kyle with ProWest. Again, I think the introduction, someone helped with that one. That was really nice. Thanks for the compliments. So yeah, I helped Kim and Emily with projects related to GIS and the ArcGIS Online and enterprise setups before COVID hit. And once the coronavirus hit, they needed some things stood up, so we helped them work through some of those projects.
A little bit about Racine. Those of you that aren't familiar, Racine County is a medium to large population county in the southeast part of the state, which happened to get a whole bunch of snow today. We have about a 200,000 population-ish, and our parcel counts, just shy of 80,000 parcels. We use Esri for parcel maintenance, the normal mapping stuff. And as you can see from this cute picture, we used to be happy before this pandemic. Seriously though, I mean, we got to do stuff at least. Yeah, so Emily and I are the dedicated GIS staff for most projects. There are additional GIS users throughout the county, but we're the heavy lifters for the, like the maintenance of ArcGIS Online and, all the foundational layers. All right, so next up is Kyle.
All right. So anyone who doesn't know who we are, ProWest, we're a small GIS consulting company based in central Minnesota. We've been in GIS for over 30 years, an Esri business partner for most of them. We work really closely with Esri to help find different needs and uses for the technology, and we have earned various types of specialty designations, 2 of which we took advantage of when we were helping out with Racine County.
So now the background that leads to the conversation why we're here today. Racine County, we're pretty traditional with our GIS use for a county. We have parcels and cadastral layers. We have standard stuff you see at most counties. And then we've had a few emergency situations in the past. The flood of 2017, and we had a missing person search that happened almost the same time. It happened right after Racine County participated in a FEMA training. And those of you that have done FEMA trainings know apparently it's a jinx. So ended up having to use the knowledge we learned from the FEMA training. And a lot of what happened at that training was it exposed our different parts of the county's individuals to what GIS is. Never had it, needed it, didn't know what it was, didn't know that you could have services put up that would help situations like emergencies. So they learned more about that during that event, and then it snowballed into help us with the flood and help us try to find, in this particular year, it was a search and rescue. Unfortunately, that person we didn't find, but that being said, the response recovery in a disaster kind of opened people's eyes to how GIS can help. And that's kind of, where if we fast forward to 2020, they actually thought about, hey, what can GIS do? But prior to, the dashboards, everyone pushing the dashboards up and putting out a hub page, it was a scramble to try and figure out what to do. I mean, none of us had planned for a pandemic before. So that's kind of where this hub page thing came about. ProWest reached out to us and offered to help us stand up a COVID hub page as and use us as an example for other customers or future customers to see what you can push up right away. And it can be a resource for not just the case data and a map, but things that the general public need in addition to just general information, but what's going to be open and that kind of stuff. So we needed to kind of circle the wagons and figure out what we needed, what the upper management wanted to see, how we were communicating with. We have 2 health departments in Racine County that operate completely separately. So that was another problem, was getting our information together. So we go into the next slide. We can kind of talk about that quick. So I want to kind of show examples more than talk about it. So the next issue is, what do we need? How is GIS going to help? How is it going to evolve, as we talked about earlier in the presentation before us? This has been going on a long time. It's not going to be the same issues in how it was in April as it is today. How is this going to evolve and prepare us for other things in the health front, the public health forefront? And how is our EOCs and our emergency managers going to evolve and stop and think of things besides just the snowstorm event, the flood, a tornado hitting? Now we're also thinking about the actual health of individuals in our county, whereas before that was not necessarily something an EOC was stood up for. So we needed to figure out, what did the public need? We needed a good place for them to find information. It needed to be better than, well, I saw it on Facebook, so it must be right. We needed something better than that. So, and we needed a public side of things, and we needed an internal side of things. Not only do you want to be able to get information out to the general public that's calling frantically everywhere because they don't know what's open, where they can get supplies. Businesses were scrambling, trying to figure out how to make things work. The financial assistance stuff that was going on, we just stuff coming from everywhere. So, we needed to find out, how are we going to get all this information into a good, like easy to navigate kind of thing. So there's a few different things that came about. We needed to figure out what was open, and if it was open, what kind of hours did they have. There were so many different data stores, so to speak, out there. So we worked, Emily and myself, mostly Emily, I'm not gonna lie, worked on organizing, where the restaurants are that were open, who was offering takeout, who was offering curbside pickup, that kind of stuff. Those were things everyone was worried about. What grocery stores were open? What were their hours? Things like that. We wanted to get into an application that you could pull it up, you could click on the map, you could figure out what was open. There's also the ability for business owners and the general public to report things, hours changing, things like that, so that we could have a fluid kind of application. Yeah, getting to the case information. As you heard from the previous presentation, every county is a little different in how health departments work and how the case data was being dispersed. We have 2 health departments. So yeah, it took a while to get a data agreement in place, and they did not want to disperse as much information as you see in other counties. They just wanted the number of cases, very limited, mapped based on census tract. The ranges of data being shown needed to be, could not be specific information. It needed to be ranges. So I get daily updates from 2 health departments, and it's just actually in an email. It's not even in a spreadsheet. And I put that into an application that is mapped, and it's strictly just a census tract map for Racine County. There's not any other additional analytics done. That is what they wanted to be available. And there is a lot of data available at the state level that can be drilled down to the county, but they preferred to just have census tract map. They do other analytics internally. They don't utilize GIS for that in this particular response. So our hub page isn't so much about the case data as it is about disseminating other information. And then as it evolves, as you can see on the screen, public, your mental health is important. And as this last year has gone, mental health is became the forefront of everyone's conversations as we sat home. And we're starting to go a little stir crazy, in addition to it might be exposing things that you didn't realize were there, because you were able to leave and go places and interact with different individuals. You didn't necessarily know that maybe you're going to go through some stress. So Emily put together a really great application that is called The Pandemic and Your Mental Health. And it is pretty awesome. It's a story map that has all sorts of great information, and it's something that anyone can go into and get something out of it. And just a side note, it was actually, if you go to the plenary at the Esri conference, it was actually in the little video in the beginning, which was awesome. Okay, so I kind of babbled there a little bit. Only time. So I'm going to stop talking about this because, as you can see, things evolve through different needs throughout this last year. But let's look at some examples, because I think that might be better suited for our time period. I don't know, Kyle, if you want to switch over to demos. We have one more screen here, but I feel like I kind of talked about this stuff.
Okay.
We talked about the food services and that kind of stuff. So we'll just go into demos. It's more fun.
All right. So thanks, Kim. So I'm going to take a look at the hub site. We'll talk about some of the applications that are in it, and then we're going to look at one of the specific workflows. All right, and you should see my screen. Yes? All right, great. So ArcGIS Hub is an Esri product that's designed to help bring your various GIS content together in one common location, and then provide context about that data and that information that you're bringing together. It also has the ability to pull in things like statistics about some of the, excuse me, the data sources that you're using, whether that be displaying a total count of data in one of your layers, maybe showing the average. There's even the ability to configure some embedded charts using JSON, and you can configure charts to show different types of information that's coming right from your data. Now for Racine County, their page was largely dedicated to sharing information about community services. Where do we go to get certain services? How do we report information about services? And the specific, sorry, I'll go back up here. So providing information such as updates and links to other resources, including the personalized videos from county executives, such as the commissioner or the sheriff, can really personalize your organization's web presence and improve that branding experience. People know it's yours. As we go through, we can see there's different types of applications and content that are shared within the hub page. Now, the applications and the content that's your hub is bringing together does not have to be GIS content. It doesn't even have to be ArcGIS content. If you have other content like documents, maybe a more traditional web viewer map experience, you can still share those through your ArcGIS Hub experience. It's just a place to bring all of that together and then provide context. So we'll go through here. They were sharing information about some of their partnering organizations, different maps that were being shared by other organizations, such as the public Wi-Fi hotspots. And then there were some embedded applications that took on the ArcGIS dashboards web application to display some numbers. And some of those statistics were being consumed from the state open data website, serving up these services and being consumed by Racine County's COVID response hub. And then there's also a web map that's been embedded to give users that instant access to some of those maps. Various Twitter feeds from county, national, state, and local agencies. Another dashboard from Madison. And then some of the common information that comes with Esri's coronavirus response template, such as how to protect yourself and how to protect others. Now, this hub, Esri came out and released this hub, and it was available to organizations for free, so long as you had an ArcGIS Online organization. You could deploy this template with using the hub product for free, and then you had to include the different types of applications you wanted within your hub, and then you could further configure it and refine this hub experience to have your information, your brand, putting in your different maps and apps. So we simply deployed that hub template and then configured it to meet the county's needs. Now, one of the workflows I want to look at, sorry, I don't mean to make anybody motion sickness by going up and down. So regarding local resources, one of the applications that came with yet another one of Esri's COVID response templates was a collection of various types of web applications, whether that was Survey 123, web app builder configurations, different types of web maps. All of those were web applications designed to meet specific workflows, and those applications can be deployed and then modified to meet your specific need. One of those templates was deployed and then repurposed. We modified it to meet the needs of Racine County, and then we built upon it. So we had deployed an application that included a Survey 123 form for the public to submit crowdsourced information. That the way it was laid out, the context it provided really wasn't what Racine County was looking for. What Racine County wanted to know was, is your restaurant or your grocery store or your local government office open or closed? And we're going to let you tell us about your location, your place. So we repurposed that Survey 123 application and turned it into a closures application. And in this case, this is related to some of the local government offices, the various official buildings. And this is actually I forget the actual template or the actual name of the application in Esri's template that this derived from, but we simply turned it into a map where the points represent the various offices that are being reported and their closures. And a user can look up their location or select a location from the map to get the status of these various, in this case, is local government offices and town halls. You can actually get the status of whether you can actually enter the building. Is it open or closed? Has the hours changed? And of course, over time, the needs have changed, so the types of information being provided would evolve as well. Now, in regards to reporting or reporting your time, we reconfigured that Survey 123 application that can be accessed, and someone from the general public or one of these offices could report whether their restaurant was open, providing takeout or curbside services or delivery, any of the things that someone would want to know about that specific location that they're looking up. And they were able to use Survey 123 to fill out this information. And we had taken that template provided by Esri and then made some modifications, such as what type of facility are you? Well, of course, the template includes a lot of great options, but there are some types of facilities that maybe aren't included in that in this template. So we simply modified the Survey 123 form to allow different types of information to be submitted, as well as some different questions as well. And then for the next part of the workflow is responding or triaging that information as it comes in. And that's something that Kim and Emily were doing for a little while. And I'm not sure if you were still doing that towards the end or if you had trained in some other staff. But whenever these points were coming in on the map, Kim and Emily needed a fast way to recognize, hey, what's a new submission, and we need to verify it before we allow it to be shared on the public closures map. So we set up a small collection of these internal maps of reported locations that Kim and Emily could use to quickly visualize where are the new reports coming in that are being submitted by the general public. And this is yet again using an example, a configuration of a web app builder that is shared with Kim and Emily and other critical internal staff, where they can simply view the reports that are coming in, modify or change any of the data if necessary, and then fill out some additional information such as operational hours. Sorry, that was in the survey form. The status, so, whether it was open, closed, scheduled to close, or impacted, and then verified, yes or no. And if it was verified, then that's something that could be shared on that public map, using a ArcGIS Online hosted layer view, where only the public could see that data. Now that workflow was replicated for things like the food resources, and there were a couple other different types of needs that we configured these different applications to meet. Now, not every map had data coming in from the same sources. Kim had provided us with a set of spreadsheets that had information coming from another system that mapped some of the asset information. Well, using that information, we're simply able to geocode some of those assets, like emergency management centers, some other official facilities and things like that. So in that case, that information wasn't being crowdsourced. They simply needed an internal map and a public map in order to visualize and then modify that data as needed. So I'm actually going to, regarding the story map, I believe Emily, you had put this one together. So I will actually turn the microphone over to you, but I can do the driving if you like, or we can give you the screen control.
You can go ahead and just slowly scroll through it. I'll just briefly describe, but yeah, as you can see, we wanted to put together, the pandemic really brought forth mental health, and not like that wasn't a new subject. It just was made very more prevalent with this pandemic. So we wanted to put something together very simple, not a whole lot of information, because we didn't want to stress anybody else out more than what they might already be stressed out with their mental health. So it's very light, simple, not a lot of text. We try to do illustrations, multiple hyperlinks throughout to try to cover different aspects and types of categories somebody might be interested in. Anywhere from, your employers to what you can do to relieve stress at home, etc. And then where can you find reliable information? So instead of just reading something on Facebook because it must be true, we wanted to collaborate and say, hey, here is the local resources and also links to the CDC for other additional articles that you can go to and read. Also, this was really interesting. How are you feeling? You can even go online and do an anonymous self-assessment to see the level of, am I just stressed, or is this more, is there more to it? Or if you're worried about a family member as well, you can go and do assessment to see there. Also for families and children, how do you talk to your kids about what's going on? How do you deal with it? How do you see the signs of stress in your kids? So there's some links and documents there that help family members with that. Also, the CDC had very nice family activities to try to get your kids involved, to try to help them understand in a more kid-family friendly way. And of course, local resources for Racine County residents. I have a web map embedded here just to show the local resources that are available within Racine County. The different organizations that people might not realize are available to the public, their information overview, their links to their websites, their contact information, all right there in a central location. And finally, if you keep scrolling towards the bottom, even more information of different organizations that are available that you might not even think could affect mental health, sexual assault, tobacco use, etc. So we really wanted to put everything nice, simple, straight to the point, all in one location that someone can just go to. to hopefully just get somebody on the right track in regards to their mental health. So that's all I got on that.
Oh, okay. I didn't want to cut you off.
Nope, you're good.
I'll switch back to the presentation here.
But there is more, so don't cut out on us yet.
Don't go, I'm just slow.
So I'll just start talking. So now you've seen you've seen some of the hub page and the types of information that we were displaying. Like what we heard earlier in the presentations before us was, more about their technical, and our hub approach was a little bit more about just general information and not necessarily about the analytical side of the case data. Their hubs are amazing and I'm jealous of them, but that isn't the approach that we took for dealing with the COVID-19 pandemic. And how, moving forward, how it has impacted us is, I think it's open line of communication that was never there in the past. It has given individuals in Racine County that didn't necessarily have access to ArcGIS Online are now logged in and using it in more data crunching side of things that it's not my area. I'm dealing with tax roll stuff and parcel mapping, and it's just not my forte, but somebody from a different department who's really into that stuff is now using ArcGIS Online, and they're using it for more of Human Services Division's resources and needs. And that's an awesome thing moving forward. That silver lining, I guess, that comes out of something like this. Negative sides of things that are impacted would, of course, be, well, besides the obvious pandemic, the budget constraints that supplies, there's different financial things that potentially counties were given, and I'm getting an unstable internet connection, so hopefully you guys can still hear me. Our lessons learned from this is you need to adapt. It's one thing I think we've all learned from this possibility of a virtual meeting, where before I just can't leave the office. Well, now you can have a meeting. You don't have to leave the office. You get interrupted and you tell them, can you wait 5 minutes? I'm on a call. I'm talking to someone and I have that visual connection, which is, it's a better interaction than not being in the same room. At least you can see the reaction. Like, you guys can see me on, I can't see all of you because you don't have your cameras on, but nonetheless, things like that. Getting my non-technical friends, family, and coworkers to use Zoom is amazing. There are, how many people? 49 people currently on this Zoom meeting. That's amazing. I can talk to 49 people right now from the spare room in my house. How can we better prepare for our next snowstorm, or hopefully never pandemic? Prior to 2020, we didn't know what a pandemic was in real terms, and none of us had a game plan in place that could ever come ready for what we went through last year. So with the lessons that we've learned, we can add it to our playbook. We have it now. So hopefully it's on a way smaller scale in the future if anything happens. But now we've got something, we can pull out of our pocket and say, okay, this is what we did the last time. What worked, what didn't work, who can work remotely easily, who really struggles with that. And then things to think about for the future. And I think you can go to the next slide on that one. The future for all of us is the coronavirus distribution. This is just an example of Esri's Hub page that they have up right now. I don't have anything specifically on our website, and I know that the next session we'll talk probably about that, so I'm not going to go too far down that, but dreams for Racine County's future. More people utilizing GIS in new and inventive ways. And it doesn't mean everyone's making a map, but doing something creative with it, something that I would never think of, because that's cool. And I want everyone to feel really good. And, you know, I love that Emily made this really cool story map about something not so great. And, you know, it was embraced outside of our organization. And that's just amazing. And I love things like that. I want to be able to find something beautiful out of something not so beautiful. And I hope that you guys got something interesting out of our presentation today, and I will stop talking. Thank you. Are there any questions? Sorry.
You did good, Kim.